Hi everyone, this is Dr. Bill with EasyToPassNClicks.com. Today's session, I know my followers have been asking for me to cover DKA. So I would like to cover DKA, which is diabetes ketoacidosis, in a snapshot. So what is DKA? It's an exocrine pancreatic disorder stemming as a complication from diabetes. Mainly, some of the risk factors for DKA include unknown or undiagnosed diabetes. Sometimes people don't know they have diabetes and their blood glucose runs higher. It can run anywhere from up to 500 millideciliters per gram. Also, infection, can, increase your blood glucose. Also stress, any risk factors that tend to increase your blood sugar can be a contributing factor, or even as basic as missing your insulin dose. Okay, so what are some signs and symptoms of DKA? Signs and symptoms include high blood glucose signs and symptoms. So that you want to look at hyperglycemia. What do you expect? Polydypsia, polyphagia, and polyuria. With these three signs, it can lead to fluid volume loss. And you want to look at signs and symptoms of fluid volume loss to incorporate that into it. So you can have hypotension and tachycardia as a compensation mechanism. In this case, the pulse, even though it's tachycardia, it will feel very weak and thready. So those are good classic signs and symptoms. The client may have fruity breath, halitosis, or acetone breath. They can also have kussmaul respiration, which is a compensatory mechanism for the acid-base imbalance. So the client may be blown off some H and CO2s to compensate. So with the signs and symptoms, you want to look at the nursing interventions for DKA. Priority interventions include, one, we did mention in the signs and symptoms that a client may be having fluid volume loss from the polydypsia and polyuria. So you want to replace fluids as much as possible. The next goal is to reduce that blood glucose. How do we do that? The client may be started on IV insulin and titrate until subcu when the blood glucose level starts to trend down. Be mindful about giving IV insulin because it can tend to reduce the blood glucose very fast. So you want to monitor your blood glucose as you administer IV insulin. While you administer IV insulin, you want to be mindful of rebound hypoglycemia. That is why it is really important to recheck your blood glucose frequently and also switch to subcutaneous as much as possible. Notice or note the shift with insulin and potassium. Whenever you administer an insulin, it can tend to shift potassium back into cells. In this case, with insulin administration, it can lower your serum potassium. So you want to be mindful and reassess the client. Notice your EKG and notice the signs and symptoms of hypokalemia, which can include U waves or flattened T waves. And then replace the potassium as such, knowing the ranges to be between 3.5 and 5. And then also review your acid-base balance content. That is it in a nutshell for DKA management. Let me know if you have any questions. Dr. Bill with Easy to Pass and Clicks. Thank you.